Are there areas of the state that are doing better or not as well as far as CCOs? A lot of the discussion in the past year has been about Portland and a CCO there. How about the rest of the state, particularly eastern and central Oregon and the coast?
Sure.
Outside the Willamette Valley.
Yeah, so the CCOs vary widely in terms of their performance. There are 17 incentive metrics that we use to not just assess CCO's effectiveness, but we compensate them based on those metrics. I believe that health share in the Portland metro area achieved 16 of the 17, and they vary across the rest of the CCOs, and that's not surprising, right? You've got different populations, different provider mixes, different size of populations that they serve. In general, we do a pretty good job across the CCOs. We had an assessment done by OHSU of the program overall, and we're doing a great job on things like reducing hospitalizations, which is a great indicator of the fact that giving people access to primary care does the things that we expect it to do in terms of preventive care that cause issues to be able to be dealt with earlier when they're cheaper. And so if you look at those 17 measures across the 15 CCOs, you'll find variance of who achieves well on what, and that was really one of the first phases of CCO 2.0 is how are we doing so far? On balance, the answer is pretty good. So what do we want that list to look like going forward? Do we want there to be more things, fewer things, different things? We also know from that OHSU assessment that when we incent financially, things actually change. You always worry when you provide incentive payments, are you just paying for what would have happened anyway? And what we were able to tell from that assessment is we actually change behavior through those assessments. So that's a powerful tool that gives us some really good guidance about what we want to do going forward and how we want to try to drive the system through the incentives we provide.